there is Chris, and she said seriously. She was not just saying that. She seriously is a convert. She loves this right here. All right, she's having breakfast with tomatoes. Well, whenever anything is considered borderline, it can be confusing because it hovers close to the average standard. That's what makes borderline personality disorder so hard for many people to understand and even difficult for many healthcare officials to diagnose. A person can seem completely fine one minute and fly off the handle the next. May is Mental Health Awareness Month. Please welcome Karyn and Jaime Lawson to help us understand what borderline personality disorder is and where to find help. Good morning.
Good morning.
All right, so that borderline issue, but what really kind of defines what borderline personality disorder is?
People who have borderline personality disorder are some of the most caring, loving people you will ever meet. The person with borderline personality disorder, that's the person that's going to remember your birthday every time. They're going to be the life of the party. The problem is those really intense emotions take over, and they can be negative emotions. And so then relationships is like, oh, I loved you, now I hate you. And relationships go up and
Passionate
down.
on both sides of
Yes.
something, yeah.
Yes.
How's that different from bipolar?
People with borderline personality disorder, they react to situations. Bipolar disorder, it's more of a chemical internal reaction.
Okay, so for you, Jaime, you knew something was kind of hard for you to deal with psychologically and emotionally as a young child.
Absolutely, absolutely. I always sort of experienced everything intensely. And I don't think that people around me really knew what to do with that.
Well, people have a tendency
Yeah.
to kind of say, okay, she's strange, get away from her, right? Okay, at age 8, you made a suicide attempt.
That's correct.
That, at that early age, is, wow, a scream for help. Did you understand why you wanted to get away, why you wanted to check out?
It seems very trivial, but the actual thing that triggered it was a connection to a kitten that somebody brought over that I wanted to keep and I'd spent the day with and couldn't keep. And something that seems that small actually created that much of an emotional response in me.
Yeah, and
I didn't know what else to do with it.
Yeah, yeah, and then of course just through relationships and with friends or in intimate relationships, all that type of stuff, really it can be a great union and then falls apart. Great union and just falls apart.
Absolutely. And when it's great, that's scary because then it means it can fall apart.
All right. How did you get diagnosed, and was that a journey in itself? Because a lot of times people are misdiagnosed or not diagnosed at all.
Right, so I've been in and out of therapy since I was 12, diagnosed with depression, duh. Anger management issues, duh.
Yeah.
You know,
You love when they say to you,
Right.
you have anger management issues.
Really?
You're like, really?
Yeah. So last year I was sort of in a tailspin and I sought out a trauma specialist who had worked with people who had sort of the same childhood issues and emotional problems I had, and she diagnosed me. I was very surprised.
Yeah. All right, Dr. Hall, diagnosis is kind of a weight off the shoulders of a lot of people who wanted to say, okay, what's wrong? You know, and so diagnosis is important, but then the next step is now what?
To get effective treatment. Like, we didn't used to know how to treat borderline personality disorder.
We ostracized them.
Yes, we did.
Get it together.
Get
Yeah.
it together. And we thought that they were manipulative. We used terms like that. We were very pejorative, actually. We know how to treat it now. And we know that what's happening is you put someone with borderline personality disorder in one situation and they can cope just fine. And you put them in a different situation and they can't.
Right.
It's that the emotions take over.
Okay, so what kind of treatment do we do that's been proven effective?
There are a couple that have been proven effective. One of them is mentalization-based therapy, and another one is dialectical behavior therapy.
Okay, what do both of those mean?
Okay, dialectical behavior therapy is a behavior therapy, which looks at the behaviors that people are having. But it's also, people with borderline personality disorder have a difficulty with...
And interesting you say born with, as opposed to something that just kind of happens along the way.
People with borderline personality disorder, we know that they're born with a sensitivity to emotions. They actually biologically experience emotions more intensely than we do. So what happens is they go into a family and it's hard to understand. You know, the child falls down, they skin their knee, and mom's saying 5 minutes later, look, none of the other kids do this, get over it.
Yeah.
Right? But for that child, it's true. And so they're going, what's wrong with me? I can't trust my internal experience. And so then that becomes invalidating and they lose their sense of who they are. So dialectical behavior therapy focuses on a balance between acceptance and change. Because people with borderline personality disorder go into the typical therapies.
All or nothing.
Yes.
Yeah.
And they say, you're telling me there's something wrong with me. And that's what people are telling me all my life. You're too sensitive. You overreact. You don't feel right. You don't act right. You don't fit in. You don't belong. And so when therapy says you've got to change, we think we're helping. And the person with borderline personality disorder says, just one more person judging me. So we have to balance acceptance and change.
And
that's
put the
what
power back into your hands.
Absolutely.
To be able to stop and look at a situation kind of with that third eye before you react.
Right. I gained a lot of self-awareness through years of therapy, but what I didn't get was, what do I do? And this has shown me what I can do.
All right. Symptoms that people should look for before we start judging people, just to say maybe there's something else going on here. What kind of symptoms in general?
Very intense emotions, like we talked about, that their emotion reactions happen quicker, they go higher, they're more intense, and they're slower to come back down. Okay? A second one is chaotic relationships. You know, very, very, very into a relationship, especially sometimes romantic relationships. You can kind of catch it because someone wants to marry you a day after they've met you.
Yeah.
Okay?
Yeah.
And
then they want to kill you 2 days later, right? All right. That's kind of some average relationships I know. But anyway, and so, Jaime, with this type of therapy, is this the first thing that's really worked for you?
It's the only thing that's ever worked for me. And anything that has sustained more than fleeting moments. Yes.
All right, and the great point is that there is help out there. Don't be afraid to reach out. I know you have a group in the audience today. There they are right there. To say, don't be ashamed of it. Just work with it, and you can live a full life if you just know what to do and surround yourself with people who are helping you in that effort.
absolutely.
All right, congratulations on your new life.
Thank you.
All right, for more on borderline personality disorder and the treatment options available, we've provided a link with more information on greatdayhouston.com. We'll be right back.